All right. Hello, everyone. So today I'm going to be looking at 6 cranial nerves for my patient. Specifically, we're going to be using the H test to examine the oculomotor nerve, the trochlear nerve, and the abducens nerve in combination. We'll use the gag reflex test to examine the glossopharyngeal nerve and the vagus nerve, both the sensory and the motor components of the gag reflex for those nerves. And then we'll just use some tongue movement to examine the hypoglossal nerve. Okay, so hello, ma'am. My name is Alex. I'm a student physical therapist, and if it's okay with you, I'm just going to run you through some quick tests we have for some nerves that along the head and the neck area that enable some essential functions for daily living. Is that okay with you?
Mm-hmm.
Great. Okay, so we'll start out just looking at some tests to see how your eyes are able to maintain their position and then move horizontally and vertically. Okay, so all I want you to do is just look at the tip of my pen, here, and with just moving your eyes, but not your head or your body, just follow it along for me, okay? Good, just eyes only, good. Good. Any pain or discomfort with any of that?
No.
Okay, good. So no problems there. If there was an issue with the oculomotor nerve, we would have seen kind of a down and out position for the eye. A trochlear nerve issue would have revealed outward and upwardly rotated eye position. An abducens nerve issue would have revealed an inward turned eye without any real lateral movement. Okay, so now the next one might not be quite as fun. We're going to do a quick gag test just to measure kind of how well you're able to do things like swallowing and phonation and able to produce speech and some essential things like that. All I'm going to do is just going to take this unused toothbrush, okay, and I'm just going to stick it, gently rub the back of your mouth in the palate area on both sides, and then I'm going to take my light and just shine in and just look for any reflexive movement. Okay, does that sound okay?
Okay.
All right, and just say ah for me as we go ahead and open your mouth. Good. Okay, one more on the other side. Oh, good. Strong reflex, so no problems there. So she had palate elevation on both sides and no real uvula deviation to either side. It stayed pretty midline, so that's a negative test there. So then the final one, this is much easier. All I'm going to have you do is just, you're ready, you can just go ahead and stick your tongue out. Okay, good. And then move it from side to side a little bit for me. Good. Any pain there? Any discomfort?
No.
Good. Okay, so that's also a negative test. Her tongue stayed within the midline the whole time. There's no real atrophy on the tongue, no real involuntary muscle twitches, and it was not moving towards any weaker sides. Okay, any questions for me?
No.
Great, thank you very much.